Hi there, I'm Dr. Albert Chung, and welcome to your friendly proctologist. Thank you so much for joining me today. Welcome to this space where I want to give you useful, helpful, and real information. Wherever you are in the world, I hope you're dealing the best that you can. And remember, today may not be so great, but tomorrow is a different day. So the topic today I wanted to focus on is Sentinel Piles. I did have a video not too long ago that kind of defined what they are and where they come from. But what about what to do with those things, right? What can anything be done about them? And it's an excellent question that we're going to get into. But please, if you're willing and able, give a thumbs up to this video, and also please subscribe. It greatly helps the mission of this channel. Alright, so the Sentinel Pile, the overgrowth of the skin from an inflamed anal fissure, right? These things can pretty much also destroy people's lives too, even though they're kind of the result of an anal fissure, which is the real earthquake in the situation, the real problem. Many people find these little skin tags are also just as annoying, may not feel the same, but very annoying. And you know, when you have more than one patient telling you that this is a problem, it's probably a real thing. Because in textbooks, I'll tell you these sentinel piles are not really described from the patient experience. Anal fissures, yes, they're painful, but the sentinel tag, they're just like, oh, it's a marker for a chronic anal fissure, but there really is no treatment detailing it or even how to deal with it. So you may find a lot of surgeons just say, oh, it's just a sentinel pile, just you can leave it alone, there's nothing we need to do for that. But then you say, but I just told you it bothers me, so, and I asked you, hey, can we do something about it? And so you may find that to be a very common reaction from your specialist. And so I think it needs to be directly asked, like, hey, this bothers me, I am suffering from it. What can you do for me? Is there something you can offer me? And when I have this discussion with my patients, these are the options that I give. Number one option is we can try a steroid cream. Why a steroid cream? Because if it's rubbery and hard, maybe it still has inflammation in it, and therefore steroid cream can help soften that guy up, kind of blunt your immune response to bring that inflammation. Because if he's hard and rubbery, that's where that guy will cause you pain when you flick him accidentally, or you're walking and you rub against that guy. But if he's calm and soft, you may not notice him very much. So if you're on the opinion that I just want to see if it's going to get better, maybe I don't want anything really done to my bottom end like a procedure, the steroid cream might be helpful. So that's option one. The other thing about this whole fissure and sentinel pile thing is that if the fissure is actively open and bothering you, that's what needs to be adjusted first, okay? And so always, if you ignore the fissure, you're just focused on that skin tag, you may get even more pushback from the surgeon because they say, no, your issue is the fissure, not the pile or the sentinel skin tag, okay? But in reality, both of these need to be addressed. But in relation to the steroid solution, it may not help very much if that fissure is still hanging out there because the inflammation is not going to just disappear altogether with that cut open, okay? So that's option number one, is a steroid cream. What is another option? Well, another option is to remove it. How? By literally cutting it off, okay? And this sounds like a more invasive procedure, which it is. I mean, I'm removing pieces of skin from the outside of your anus. But why does it help people? Well, because you're removing removing that soft or rubbery part skin that keeps getting hung up on stuff, or it keeps rubbing on the skin on the outside of your anus. You feel it when you sit down, you feel it when you're walking around, you feel it when you're pooping. And if it were shorter and level with the rest of your bottom end, it can bring some relief because he's gone. And this is an option that I present at the same time as using a steroid cream, because sometimes the fissure doesn't go away right away, right? But that skin tag also pisses you off. And so do you need to live with both? I mean, do you have to heal the fissure first and then you can get the skin tag removed? I would say no. But that's, again, a discussion. I'll tell people, hey, I can cut that guy off for you. You may feel good with that. The fissure is still there, but you know what that's already like because you've lived with it for some time. But understand that if that fissure stays there for a really long time, the skin tag may come back to a certain degree. It may not come back to the full 100% size it was before, but you may find that your skin may be raised a little bit when it's all done healing, when the fissure is all done healing, okay? Because of again, that chronic inflammation, which is what makes these sentinel piles build up their mountain, okay? But that's always an option to remove it, and that's something I do offer people. What's another option? Well, this other option is something that I actually do not offer, okay? You don't hear me say that too often, but other surgeons do, and I have my own opinion on it, so take a listen if you feel like it and see what you think. What is a fissurectomy, okay? And I'm going to do a video on the fissurectomy later, but in brief, a fissurectomy is like fissure, anal fissure, ectomy, removal of it, but it's not really like cutting it out. It's more like cleaning up the cut, maybe a little bit of shaving, possibly kind of getting that wound freshened back up again. And then if there's any sentinel piles or skin tags, usually those are removed and cut off as well. And the studies, this procedure used to be extremely popular back in the day, but I find that this procedure is done less and less, is not considered to be standard anymore for treatment of an anal fissure. In fact, I don't perform fissurectomies. Why? Because I don't think it works. Okay? Why do I think that? Fissurectomy, the cleaning of a wound does not create it does not necessarily create a better healing ground or a foundation for a wound to heal better the second time. In reality, the fissure is still there. The fissure is the cut, the wound. So you haven't changed that fact. A cut was there before the surgery, and now a cut is even bigger after surgery because now you scraped it off and you kind of pissed it off. And then you cut off the skin tags. Well, that's what I could have done in the office for you. You didn't really need to have a surgery for that. But cutting those little pieces of skin off doesn't do anything for the fissure, okay? What does a fissure need? Well, it's what I've said before in other videos. The problem with the fissure is the internal anal sphincter. It's your anal muscles. Why doesn't that cut heal? That internal anal muscle is squeezing so hard. It's preventing blood to get into the wound and give it the nutrients it needs to heal. Okay? So if you have not treated that internal muscle to relax it, that fissure is not going anywhere. In fact, and this surgery hurts, okay? You're operating or you're doing stuff to a cut that's already painful. So if you expect all of a sudden to not have pain after the surgery, no way. You're going to have more pain because now it's been messed with, okay? And some people will even stitch a fissure closed. That's another option. Option number 4, they'll take a suture and needle and stitch it as if it's a cut on your arm, okay? This also does not work, and many surgeons will do it. people in my specialty, this has pretty much fallen out of favor, but you'll find a lot of other surgeons, for example, general surgeons, that will do this. And I'll tell you, it does not work. And it's very painful, okay? You hate pooping with a fissure. Imagine someone putting a stitch and putting a needle through a fissure. That's not fun. That's not very, I mean, it's just not nice. And now you have a stitch or thread going through your fissure, which was painful to begin with. Okay? And again, these wounds, if it could heal and close on its own, it would. Your body wants to heal wounds. The body senses a problem, knows there's an issue, and that's why you have pain. The inflammatory response, the immune system is doing its job. But closing it, bringing the skin edges together with stitches, I'm sorry, it's essentially incorrect. The problem again is not that because the skin can't touch or it can't close on its own, it's a problem. The muscle is the problem, the internal anal sphincter. These closures rarely work, and if it did work, well, congratulations, you beat the odds. But vast majority of people, in fact, it's pretty much accepted that this is not an acceptable treatment for an anal fissure. So I hope that this video brings you some education, some things to think about when it comes to, how to deal with these sentinel piles. If they're becoming symptomatic and giving you issues, I hope that this is giving you something to think about and discuss with your doctor. I wish you the best. Please like and subscribe. If you're interested in a video consultation with me, please look in the description below. I'm excited to meet with so many people around the world, and I'm so glad that you're here with us today. Thank you so much. Take care. Bye-bye.